going for foods that are traditional, going for foods that are local, going for foods that are seasonal, going for foods that are balanced, and going for foods that are nutritious. What you can extract from that is really, thriving off of, foods that are colorful.
So, for this episode, we have a very special guest that we'd like to introduce, Dr. Colin, who is founder of the Chef Doc and also the author of the new plant-based cookbook, Empowered Kitchen. He's also a specialist in lifestyle and culinary medicine, and we're here to discuss plant-based diets and talk a little bit about his new cookbook. So, welcome, Dr. Colin.
Thank you so much for having me. Pleasure to be here.
Of course. Yeah. And so, why don't you just tell us a little bit about yourself and your background and kind of what motivated you to write this book, just to kick us off a little bit?
Sure. So my name is Dr. Colin Zhu. I'm the founder of the Chef Doc, and so basically, I'm trained in family medicine, and I specialize in lifestyle and culinary medicine. And basically, how I got here is when I went into medical school, similar to a myriad of my colleagues. When you go through training and schooling, we've received a kind of like a paucity of nutrition, lifestyle, self-care type of education. A lot of things that we get taught on is really on how disease manifests and how drugs work. And so I followed a lot of my predecessors, brilliant clinicians, and realized that no matter who walked through our door, whether it's like low back pain or a cough, they always had some sort of chronic lifestyle risk factor attached to them, whether it's high blood pressure, diabetes, carrying some extra weight, things like that. And so I said to myself, I'm really ill prepared. And so, long story short, after medical school, I had a gap year, and I took that gap year to enroll myself into a health supportive culinary arts program, culinary arts school, because I didn't want to understand just nutrition. I really needed to understand, why is it that we have such a large disconnect with where food comes from and how it arrives to our plate. And so I went to school just for that, and also to enhance communication with my patients and clients. I also got certified in health coaching as well. And so, using that education, I kind of enhanced my training afterwards, which is family practice or general practice afterwards. And from there, I use it for various mediums, whether it's public speaking, whether it's really education base in terms of my brand, the Chef Doc, and a lot of consulting work. So that's kind of a nutshell what I do.
That's very cool. I'm actually really impressed that, as a doctor, you made those dots, because I don't feel like a lot of doctors get it in terms of, expanding beyond what they just learned in school. And like you said, being it more lifestyle, being it more diet, especially food, it's such a just crucial part of our lives. And it's not easy for people to make these changes. So the fact that you not only got schooling in culinary medicine, but then also got a health coach degree, which is probably something you also didn't learn in medical school, is, just a beautiful like merge of like that integrative side.
Hmm. Yeah,
Yeah.
for sure.
Yeah. And obviously, we're holistically based here, and our theme is always trying to help people uncover the underlying causes of their health concerns, exactly like what you described. So I think the tides are really turning nowadays, where we're more focused on discovering how people's lifestyles impact their health, rather than just covering up the symptoms with a drug. So we really like that.
Yeah. So when you say, that was kind of the motivation to write the book, right? What would you say makes it stand out from other plant-based books?
Yeah, thank you for that. So, the title of the upcoming cookbook is called Empowered Kitchen. And right now, we are raising funds for book production, set to be published and released in 2026. And so, In order to kind of talk about it, it's really you need to understand, giving your listeners a little bit of context is, we're not just in America, but also globally, we face a myriad of issues from nutritional standpoint, from a ecological standpoint, from an environmental standpoint. And so the aim of the book is really to connect three dots, pretty much how our food choices impact our individual health, and how that creates a ripple effect towards our outwardly, towards our community, as well as planetary health. And in America, more than half of the top 10 causes of death, the top two being heart disease and cancer every single year, are heavily associated with diet and lifestyle. And so we find that if you just optimize your diet, you improve your physical activity, and you basically stop smoking, you can actually prevent upwards of 80% of chronic diseases. And so it is, very, very important, to your point, Carla, is that yes, medical doctors didn't receive enough education. And because of that, surveys have shown that we are less apt and less confident in order to dispense it. And in my professional realm, lifestyle medicine, I think it's so poignant because it's also a profession where you take accountability for yourself. So a lot of things that I preach and practice and distill for my patients and clients is something that I incorporate in my life every single day. So it's very, very important. So yes, the book aim is to cover those 3 points. And I don't write it just by myself. I know that there's way more brilliant minds than myself. And so I had to recruit about 35 other experts, ranging from the fields of food as medicine, from an ecological point. So we have doctors, we have chefs, we have farmers, we have environmental experts, to be able to weigh in, to be able to have this collaborative effect. I was, looking at cookbooks, and yes, it's great to, see another cookbook written by a celebrity, but it's not really there to entertain and just to have beautiful, recipes displayed on pages. It's really, the goal of it is to make an impact. And eventually, we wanted to go back. The proceeds of this book eventually is 100% is to go back towards, the ecological effort. We know that replanting trees on land and in ocean helps to sequester carbon. One of the greatest effects to be able to draw down greenhouse emissions and ultimately climate change, and as well as to clean up our current issue of plastic in our oceans. And so those are what the efforts are geared towards.
Yeah, so curious about some of the ecological and environmental impacts. What can you tell us about generally the population adopting more of a plant-based diet that would further sustainability and make any kind of improvements to the environment?
Yeah, so I think one of the best ways to describe it is, kind of on the piggyback of the work that has been done, specifically back in 2019. So if you look at the EAT-Lancet Commission report, which is a behemoth of a scientific, effort, and basically, their singular question was, United Nations estimates that the population globally will reach towards 10 billion by 2050. And so the question is that how do you healthfully and sustainably sustain food systems that can not just feed, but also be able to preserve and protect the planet from not going outside of unsustainable boundaries. And so that was the mission. That was a behemoth of a mission for that report that was done in 2019. And so just to kind of, give you, some facts before that is that they said that, it was really to preserve and be able to prevent upwards of 11 million deaths, premature deaths, cardiovascular, being at the top, type 2 diabetes, cancer, things like that. They also found that food on an ecological scale single-handedly contributes the largest in terms of land use, in terms of water consumption, specifically fresh water, in terms of biodiversity loss, and also in terms of greenhouse, emissions. Our current food systems right now contributes more to greenhouse emissions than the entire transportation sector combined. And so, on an ecological perspective, it's a huge thing to be able to understand. In America, by itself, food. If you look at, what do we subsidize? Corn, wheat, soybeans. Those are our top wheat. Those are our top crops, and it takes up a lot of land to be able to generate all that. Less than 10% of that actually goes towards human consumption. 35% of that goes towards ethanol for the transportation sector. More than 45% of that goes towards animal agriculture. And so, from an ecological standpoint, things need to shift in order to both healthfully sustain, not just here in this country, but also, globally as well. If we want to be able to reach the climate Paris, agreement, as well as reach towards the 2030 United Nations sustainability goals.
Hmm.
It's a
Sorry,
lot to unpack.
I know I'm thinking through right now everything that you just mentioned. Again, we can always edit this.
Well, I do have a question about that. So, Carla and I are not plant-based per se 100%. We obviously promote the fact that people should eat more of a plant-based diet. I've always been curious about in terms of ecological impact. So I think the latest statistic I read was something like 30 to 60% of land cannot be used for farming, but can be used for grazing, and sort of this ecological footprint that we have, that animals can graze on a certain portion of the land that would not be usable for crops. And so adapting a fully plant-based planet could actually have some impacts in that way. What do you think about that?
Well, I think the message here is really about shifting in terms of so what they found. So if we just go based off of that EAT-Lancet report, what they're advocating is not a fully plant-based, approach. What they are, advocating is what they call a healthy reference diet. And what that means is that you're looking at a reduction, for example, of red meat, because we find that because of we can prevent upwards of 11 million deaths per year. It's because of things like increases in saturated fat, red meat production, and very, very low consumption of whole food foods like nuts, seeds, beans, legumes. In America by itself, we don't have a protein deficiency. I've never diagnosed a protein deficiency in my clinical practice. What we have is actually a fiber deficiency. And so 95, 97% of Americans don't get enough fiber, nutrient, needs. And fiber only exists in plant food. It doesn't exist in animal food. And so, from a clinical nutritional standpoint, it's huge. From an ecological standpoint, it's also like we talked about before. So the message from what I can say as an individual is really just to eat more plants. I think that if we can, everyone can afford to eat more plants. If everyone just adopted just like a meatless Monday, we would all stand to benefit. So just from that EAT-Lancet report, it's not saying to go fully, plant-based. It's more about how do we shift certain food production that, we could both healthfully and, sustainably be able to, take care of both buckets, as the population, grows. On a global scale, more than half of the Earth's land surface is towards, agriculture. right? About 20% of the Amazonian rainforest is mowed down, deforested, because majority of that is for animal, agriculture. So if you, you just kind of have to look at where our, current facts are in terms of how the land is used, and then just kind of compare it with these mass data sets that we have in terms of where the population is at. On a global scale, 2 billion people are obese and overweight. 41 million children globally are overweight, and 2 billion of that are undernourished, which lacks the essential micronutrients such as iron and vitamin A. So there's a lot of statistics and data, to show that we need to shift, so.
Yeah.
That's
Yeah.
fascinating. You're our second guest in a row to say that we have a fiber deficiency and not a protein deficiency, which I think is everyone is so pro protein right now. It's really interesting to hear you say that too. And of course we agree.
We do. And with that point, what goes through my head is I completely agree. And I think Mary and I obviously agree too. And like you said, there's always room to eat more plants. Like that's the number one thing we want for everyone. Um, as a women's health podcast and as someone that works with a lot of women, I'm a clinician myself. I'm a dietitian. And as someone who works with a lot of women who have PCOS that are obviously kind of, and not necessarily women with PCOS are necessarily getting older, but I would say that I work with older millennials. And I find though that when people tend to get older, they tend to eat less protein. I wonder if that's true for you, but specifically for women, it can really start to affect their hormones, their energy levels, their mental clarity. And I see that when they increase their protein to above the recommended amounts, then they start to really thrive. We start to see kind of a change in their health and their symptoms. I wonder if the same is true for you, Mary, but would love to hear your take on that, Dr. Colin.
I think when we talk about protein specifically, I like to frame it where not every protein is created equal, and I think the framing is how is the protein packaged, right? Because the protein that's packaged within coming from an animal is different than how it's packaged when it's coming in a plant. And I also like to say that one of the myths that's very pervasive is that plants have no protein, which is entirely untrue. Because if you look at just looking at animal species, you look at the largest species of animals on the planet. Most of them are herbivores. Giraffes, rhinos, gorillas, elephants, the blue whale. Right? These are humongous animals. And so it's really about how it's packaged. And so the body also processes it, very, very, differently, right? At the same time. I would probably say, yes, protein is very important, but it's also important to, include the fact that, there's other pillars of health that we have to consider. As we age, we tend to become we're already sedentary, but we tend to become more sedentary as we age. We, don't really maintain or maybe lose out in terms of relationships. We don't manage our stress well. We don't have restorative sleep, right? And then also addictive substances that we have to consider as well. So it's a very comprehensive approach. Kind of like what you said, a more holistic approach when you're sitting down with the patient or and a client. And then on top of that, our environment becomes more and more toxic, every day. So it's very important to consider all these factors.
No, completely agree. And thank you. It's like Mary said, I feel like protein is such a big topic right now that everyone's talking about, but it sounds like the takeaway message is there's a lot of factors that are important. Protein is just one of them, and we need to be able to kind of holistically go about our health goals.
Yeah, for sure.
So I want to ask you something. Obviously, our listeners are pretty savvy, and we see across the board a lot of improvements when people adopt a plant-based diet. So I'm curious about this thing called the healthy user bias, which is people who tend to be vegetarian or more plant-based or even vegan probably are more health conscious in other areas of their lives, more likely to exercise, more likely to meditate, engage in stress relief. So what kind of improvements do you think you see actually from people who go from, say, a standard American diet to a plant-based versus people who, may have this kind of healthy user bias situation going on and are just healthier regardless of the plant-based diet?
Um, That's interesting. Yeah, I would probably say, answer this in two ways. Like one, when we recommend to eat more plants, they're based off of, clinical studies, right? We're talking about tens of thousands, of data sets and populations that we study. From a clinical point of view, I can tell you that, when I recommend eating more plant forward or just eating more plants. My message is simple because as a family practitioner, we take care of everyone. We're trained to take care of everyone from birth to grave. And so, I have to be able to meet people where they're at. And I have to be able to help people, nudge people on a spectrum. So when I teach, it's not binary, it's not black and white. It's really about how can I help the individual in front of me to nudge them forward with small actionable changes to, be sustainable. Because at the core of every healthy living, pillar are behavior change and habits that you have to be able to nudge forward, and that takes time, that takes practice. Being unhealthy takes practice. People do not become unhealthy overnight, right?
Mm-hmm.
And reflexively being healthful and in a positive living manner also does not take overnight. So it takes a lot of different steps. But just clinically, anecdotally, I've had patients that have lost, just in this last year. I had one individual. He was in his 40s. He was more heavy set, had increased cholesterol. He was a traveling salesman. He's a Filipino. Cultural matters, right? Cultural sensitivity in terms of food matters. So in the Filipino diet growing up, it's very carb heavy, very rice heavy, very heavy protein. And so I told him that, we need to be able to adopt, such and such way, just kind of how I explained it to you. And basically, in 2 months, he lost 30 pounds and had more energy. And, he came back to me that, that this happened. And I didn't have more than 2 sessions with him. A second individual lost 21 pounds in 3 months. And improved, his blood pressure. He was able to reduce, a medication. Another individual, she lost 11 pounds and dropped a lot of cholesterol points. And so those are just anecdotal examples. I think that based off of the current science, it has numerous effects. So, like I said, it just depends on the individual. But in general, we want people to have more nutrition in terms of vitamins, minerals, antioxidants, phytonutrients, and fiber. That's what we advocate, because really to me, most chronic diseases live in these four roots. You have chronic inflammation, you have oxidative stress, kind of like rust to a car. You have lack of fiber, and you have dysbiosis, which is an imbalance of your gut microbiome. And so if you're able to course correct with that, in addition to the other pillars of health, then you're setting them up for success.
Mm-hmm. Yeah. I'm curious, what does a healthy diet to you look like? What would be your recommendations from this cookbook? What would that entail on a daily basis or on a meal basis?
Yeah, so nutrition is always the evolving science, and it's always the controversial, very charged for everyone. But yeah, in terms of health, healthy, and in terms of kind of like what that looks like, I kind of like to go back to the core values that I was taught when I was in culinary school. And the founder of my culinary school, she was a PhD, and she stressed the values of going for foods that are traditional, going for foods that are local, going for foods that are seasonal, going for foods that are balanced, and going for foods that are nutritious. What you can extract from that is really, thriving off of, foods that are colorful, right? If you look at the standard American diet, which is high in processed carbs, saturated fat, low in, vegetables and fruits, and healthy fats, you look at just the colors, right? What is it predominantly looking like? It's basically anything from like, white, beige, brown, right, yellow, right? Very lacking in color. And when I say, we want to be able to incorporate as many colors as possible, eating the rainbow, it's really just that because, nature, Mother Nature has, done a very good job in incorporating what the body needs, based off of what it looks like, because evolutionarily we're wired to look for things that are, attractive. And that's what's missing. Is really, colors. We're talking about like the purples from red cabbage. We're talking about, the deep reds of beets. We're talking about, the oranges and yellows from, peppers, things like that. So we want to be able to incorporate that. We want to be able to incorporate healthy portions of whole grains, beans, legumes. If you look at the blue zone, which are the highest concentrations of people living over 100 around the world, one of the foods that they have in common are beans. And that's something that, we're lacking. And it's very high in so many minerals, protein, fiber. So having, a plate that has high beans, high legumes, and starchy vegetables and plants, it's very, very, important. And but also to your listeners is that food doesn't come in packages. Another way to look at this is that real food doesn't come in a package. Real food doesn't actually have a nutrition label, and real food eventually dies off, which is perishable. So a lot of times I just tell, my patients or clients, just stand in front of the produce section for a majority of your grocery runs and minimize, what you get from the shelves, which takes up 75-80% of the supermarket.
Yeah, that's always great advice. And to your point, I think this is why people are so confused because we have so many different communities, the biohacker community, the paleo community, the carnivore community saying that phytic acid in vegetables is harmful and legumes. And there's a lot of disinformation out there, but the studies we actually do have show this correlation between longevity and fiber intake, like you said, and legumes were kind of demonized by so many different subsets of the nutrition world for so long that, but again, we do have that data on fiber, and it is our goal here in this podcast to dispel a lot of these myths that cause so much confusion out there with diet. And that's the reason we have jobs, is because people don't really understand what they should be eating or how to best individualize their diets.
Yeah, I would probably say to make this simpler for people is that because we're more, fiber deficient, I want you to try out just literally one new vegetable or one new fruit, a week, right? Try one new recipe, a week. If your entire lexicon, your vocabulary of, plants, vegetables, and fruits starts with a potato, then let's go outwardly. Let's start with the onion. Let's go outwardly from there. Let's go to a shallot, right? If it's a potato, go outwardly to, a sweet potato. If you go outwardly even more, go to a Japanese, purple, potato, right? So, it's incredible because the plant kingdom is made up we find that about 300,000 species of plants are actually edible, right? And upwards of only about 150 the average American actually consumes, which when I found out that fact, it was actually higher than what I think. Most people don't even recognize most of the produce aisle. And when you can't recognize or you can't spell it out, you're just not going to grab for it. So I would probably say, try out one new vegetable, one new fruit, right? Once a week, right? We have a lot of great resources in terms of recipes in the format of the internet, social media, and YouTube. So just, be able to just, cook more.
Yeah, you actually
Yeah.
answered my next question, which was what sort of tips do you have for people just trying to get started? But that was perfect.
I have a quick question. What would be your recommendation for people who may not have access to these types of colorful fruits and vegetables that you're mentioning, or maybe limited and can't afford, to eat whole foods all the time? Because there's a lot of people in this country that live in food deserts and may not be, as privileged as some of us that have access to farmers markets and local foods. And so I feel that's a lot of my career. I've worked with people in those specific demographics, and it's been very challenging in terms of really kind of guiding them to eat these whole foods because
Hmm.
of the access.
Yeah, and you speak to a very important point. I would like to add to that 47 million people in America face food insecurity, food deserts, lack of food access, health inequities, social economic, inequities. They're not random events. These were systematically created many, many decades ago.
Mm.
So I would like to tell your listeners that it's not your fault that, the environment is not set up for you to succeed. But to answer your question, ultimately we need to have a multi-layer, from a top-down approach, both federally, statewide, and citywide, to be able to change
Yeah.
the system and change the surrounding environments, for to increase, food access. And so I would probably say, healthy food. One of my colleagues described that healthy food is more of a pauper's diet. So if you look at, whole grains, beans, legumes, like rice and beans, that kind of combination, or whole grains and beans and legumes, that kind of combination exists in so many different ethnic groups in various different formats, right? From the Hispanic and Latino population to the Asian population. Eating more plant-based, outside of America, a lot of ethnic cuisines actually do it a better job than Americans do. So I would probably say, if you don't have access to a high quality supermarket, if you can, get towards, your local farmers market, being able to, decrease, food miles, right? If you can't get fresh produce, you can opt for, cans, frozen foods, right? And in terms of urban spices, don't go to your regular supermarket. If you are close to an ethnic market, source it from there, right? If you're part of a wholesale club, like Costco, Sam's Club, BJ's, like you can save money like that. It's really about understanding what's near you. Look at food pantries, right? And look at your local health system. Look at your local culinary school. Actually, they might actually have foods resources as well.
Hmm.
Mm. Those are some really good, great tips. Thank you. Anything else you'd like to mention that we didn't ask you, whether it's about around the book or anything else?
No, I appreciate, you guys having me on. I would probably say, I would say on the footsteps of coming out of a global pandemic is that we now know that what you say, don't say, do not do has a ripple effect, affects someone else.
Hmm.
So the aim of the book is really about, your food choices don't just affect you. The food choices affect everything and everywhere else. And so the goal of the book is to merge these points of disconnection. And the point is, if you get nothing else from this, it's really that health is wealth. Investing in your health is the biggest return on investment that you can take for yourself. And because I get a lot of patients that don't come to the doctor, I get a lot of patients that wait until they actually get sick to go to the doctor. I would encourage your listeners to treat your body as a car that you're only going to get one time for the rest of your life. And so if you maintain your car the same, if you maintain your body the same way you maintain your car, you'll be, better off. Go to your doctor, get your blood pressure screen, go get your, blood sugars checked, get your cholesterol, checked, right? Measure the circumference of your waist. These are just basic, biometrics, for you to obtain. Understand what your family history is. Where does your family history, come from? But also understand that that is not your medical destiny, right? Chronic disease is about 20% genetics. 80% of it is based off of what you choose on a daily basis.
Mm-hmm.
Absolutely. Well said. It's a great note to end on.
Yeah, we really thank you for sharing all of this knowledge with us. You shared a lot of really good tidbits and tips and actionable steps people can take to get started. So, you mentioned the book is going to be out next year. Tell people where they can find it.
Yeah, so we're using a crowdfunding company to help us out, and we are looking for support. This can't happen without everyone's help, and so we are encouraging people to support. So we have the links that. We have links, we have QR codes. It basically goes to this one pager, and you can read about it, you can watch about it, and you can get updates and follow along with me and the other experts, the other team of experts that we're going to collaboratively. It's basically we're having a Avengers like approach to be able to tackle these big issues that we have, not just in this country but globally as well. So helping us helps you, and
Mm,
helping us helps you and the planet, because we make no money from this.
mm,
Like I said before, the proceeds goes back towards replanting, trees on land and, and the ocean, and to help clean up our global plastic issue on our planet. So this is, it helps everyone.
mm.
That's awesome. I love to hear that. So yeah, thank you for that contribution. That's huge.
You're welcome.
Yeah, and thanks so much for joining us today. We really appreciated your presence.
Yeah.
My pleasure.
Awesome. I'll check it out when it's out. Thank you. Have a great day.
All right. Thank you.